Hi everyone, welcome to 𝗖𝗵𝗺 We are discussing very important topic of skin, soft tissue and musculoskeletal system. Welcome to the class 4th, and today we are going to discuss about herpes. Herpes is a very big group of viruses. It has got 8 viruses in them. This lecture is going to be a little bigger one, but don't worry, in description I will try to give you the timelines. So whichever virus you want to study, you can directly jump to that. So mainly the very important viruses in herpes family for the skin and soft tissue are varicella, Epstein-Barr virus, 𝗵𝗵𝗵𝗺 sarcoma virus. Coming on to herpes virus. So from the knowledge of your general virology, you must be aware that herpes was a double-stranded DNA virus, belongs to the group of enveloped viruses, and it is a 𝗵𝗵𝗵 symmetry virus. Okay. So there is a beautiful property of herpes that they are capable of hiding. They have a property of hiding. They can hide wherever they want. Okay. So based on this property of hiding, they are divided into 3 parts named as alpha viruses, beta viruses, gamma viruses. So alpha viruses can hide in ganglia. My dear friends, in India earlier females, wives used to call their husbands by saying AG. Okay. So AG goes together, G for ganglia, A for alpha. Okay. So alpha viruses are having ganglia. So what are these viruses? HSV-1, herpes simplex virus 1, herpes simplex virus 2 and herpes simplex virus 3, that is called as Varicella-Zoster. So herpes simplex virus 1, 2, varicella. Similarly, the beta ones, they are fond of staying in secretory glands, just like 2 examples, CMV, that is HHV-5 and 6 and 7, whereas gamma viruses are having the latency in lymphoid tissue, and they are Epstein-Barr virus, that is HHV-4 and 𝗵𝗵𝗵𝗺 sarcoma HHV-8. Let me tell you the abbreviations. HSV means herpes simplex virus, HHV means human herpes virus. Got it? So my dear friends, it's very important for you to understand all these things, that AG, alpha viruses are in ganglia, beta viruses, okay, B for beta, B for traveling by bus. So B for what? Beta, S for salivary glands. Okay. And if you can see the glands written G and L, please remember the gamma ones are going to be there in L, that is lymphoid tissue. So this is the way to remember them. So you know that this is a list of human herpes, HHV 1, 2, 3, 4, okay, 3, 4, 5 and 7 grouped together, 5, 6 and 7 grouped together, and then 8. So HHV1 is also called as HSV1, HHV2 is also called as HSV2, then the 3 is V. So can you see 3V? They are phonetically similar. So HHV3 is V. Okay. Then 5. Okay. So 5 is important. Remember, 5 is 𝗖𝗵𝗵𝗺virus. Please remember, 5 is 𝗖𝗵𝗵𝗺virus. 6 and 7 go together, and 4 is Epstein-Barr virus. So actually people confuse between 4 and 5. Remember, 5 is mega, big number. Okay. And 4. So this is going to be 𝗖𝗵𝗵𝗺virus. And 4 is going to be Epstein-Barr virus, Epstein-Barr virus, okay, and 8 is going to be 𝗵𝗵𝗵𝗺 sarcoma. 8 is going to be which one? 𝗵𝗵𝗵𝗺 sarcoma. So we'll start with HSV1 and HSV2, that is herpes simplex 1 and herpes simplex 2, okay. For example, you are standing and you have got your pelvic area, waist area. So above the waist, the infection will be caused by herpes simplex 1, but below the waist, the infection will be caused by herpes simplex 2. So above the waist, herpes simplex 1, and below the waist herpes simplex 2. Now tell me which one is the big number? 2 is the big number. So remember 2, T for 2, T for troublesome. Why 2 is troublesome? Because it is more resistant to antivirals. Okay, more resistant to antivirals, and because it is more resistant to antivirals, HSV2 is having a bad prognosis. The clinical features for both of them are very same. Like for example, they are responsible for causing the blisters. What is blister? Painful ulcers. I have told you in one video that whenever the word comes herpes, you should know two very important, or rather three very important things. One thing, herpes is always painful. Other thing, ulcer. Other thing, 𝗖𝗵𝗶𝗵 is the drug of choice. So these three things is applicable for everyone. Yes, the site obviously may vary, just like herpes simplex 1 is above the waist, 2 is below the waist. So responsible for causing the blisters over the skin and the mucous membrane, painful ulcers called as herpetic ulcers or called as cold sores. Okay, there is no inflammation, no heat, these are cold ones. Okay, so remember cold sores. Then it can cause 𝗵𝗵𝗶𝗶𝗵𝗵. So for example, I mean some dentists or the people who make the dentures, okay, they are sometimes careless and not wearing the gloves properly. So with the help of their, with the fingers, they might transfer the they might transfer the herpes, or they might get in contact with the herpes, and mostly the herpes 1 because it is above the waist inside the mouth. Okay, so 𝗵𝗵𝗶𝗶𝗵, right? Next is erythema multiforme. So erythema multiforme again caused by herpes. That means there will be erythema, red erythema that is going to happen. Next is herpetic keratitis. So keratitis means what? Inflammation of skin. Inflammation of skin is keratitis. And with this keratitis, because itis is coming, you can remember two more: meningitis, encephalitis. Okay, meningitis and encephalitis. But remember, the most common lobe involved is temporal lobe. Okay, temporal lobe, and this meningitis is called as Molleret's meningitis. So the meningitis happening with what? With, tell me, the happening this meningitis is happening with what? With the herpes. Okay. So how to remember? Remember, okay, I'll write the mnemonic. She got admission in KEM, Mumbai. So KEM is a very famous hospital in Mumbai. She got admission in KEM. So she means S for skin and mucous membrane blister, H for 𝗵𝗵𝗶𝗵𝗵, E for erythema multiforme, KEM means K for keratitis, E for encephalitis, M for meningitis, and M for Molleret meningitis also. So she got admission in KEM Hospital, Mumbai. Just like this. So how will you diagnose 1 and 2? Remember, ELISA and PCR is something which we used to do, which we are doing right now. But Tzanck smear is a special smear which shows a giant cell, and that's to a multinucleated giant cell. Giant cell is more of a domain of pathology, so pathology ma'am will teach you. But for now, just remember multinucleated giant cell. How will you treat it? The treatment is by 𝗖𝗵𝗶𝗵𝗵, as I have discussed before. Coming on to Varicella-Zoster virus, that is HHV3. I am sure one of you, every one of you, or some of your, most of your contact and everyone come to have the Varicella-Zoster infection once or twice in their whole lifetime. My dear friends, Varicella-Zoster, okay, so remember, Varicella-Zoster means varicella is the chicken pox. Varicella is the chicken pox. And what is zoster? So zoster also called as shingles. You can remember Z and S look alike. Zoster and shingles are the reactivation of Varicella-Zoster virus, reactivation, because I told you that varicella belongs to what? Varicella belongs to alpha class of herpes, and they have an habit to hide themselves in the ganglia, and the varicella hides itself in the dorsal root ganglia of the spinal cord, and then it may show reactivation. And now when it is going to show the reactivation, it is going to affect the single dermatome. Why? Because if I make the spinal cord, although not very perfect at making the drawings, but then yeah, if I make the spinal cord and for example it was residing here in this dorsal root ganglia, now when it will be reactivated, it will be going to the dermatome where it was residing. Okay, this reactivation will be called as zoster or shingles, and remember it is affecting single dermatome. Usually it is unilateral. Usually it is what? It is unilateral. Okay, you got it? Great. So I told you what is the meaning of varicella and zoster. What is the mode of transmission? The mode of transmission is droplet or aerosol. The droplet infection or aerosol. How is the rash? So remember, the rash of varicella start on the trunk, goes to the limbs. Start on the trunk, goes to the limbs. Okay. So everybody loves watching TV. Everybody, what I said, everybody loves watching TV. So what does that mean? The varicella is going to go to T, that is trunk, and loves L, that is later to the limbs. So firstly trunk and then the limbs. And how the progression happens? First of all, there will be macule, then there will be papule, then there will be pustule, that means having the pus, and then there will be dried one, scab formation. My dear friends, please remember that this is something which we call it as pleomorphic rash. This is something which we call it as pleomorphic rash. The macule, the papule, the pustule, the scab formation, multiple stages, pleomorphic rash, and this is very important question. Mind you, P and V go together, as in my name also, V for varicella, P for pleomorphic rash. Please remember, for example, today somebody develops varicella, so you should be very careful and call all the contacts of that patient 2 days before. For example, today is 10th August, okay, for example, today is 4th August, so you should call the people who were in contact with this patient on 2nd and 3rd August, and you should trace or you should advise the patient that don't come in contact with anybody for the coming 5 days, because the infectivity is very high 2 days before the rash and 5 days after the rash. What are the complications? See, a lot many people do this whenever blister comes of varicella, they or the macule, papule, pustule, something comes, people scratch it, and once people scratch it, it is a breeding ground for the secondary bacterial infections. Secondary bacterial infections start growing. That is also okay. But if varicella entered your lungs, my dear friend, it is fatal. It causes pneumonia that is not cured and it is fatal. Although the chances of going into lungs is rare, but still it is fatal. Diagnostics, obviously ELISA and PCR. As I have told you, it is self-limiting, but in the patients who are immunocompromised, we should start acyclovir, and Varicella-Zoster immunoglobulin is given post-exposure. My dear friends, although the OBGY faculty will teach you, but still in pregnancy, please don't give varicella vaccine. Varicella vaccine is not given. VZV, that means Varicella-Zoster immunoglobulins, can be given in pregnancy. Always remember, vaccine is having the oca sting. So varicella is having the oca sting. So there is a song in Hindi, वो ल्म्हे 𝗲𝗵𝗵𝗵. So, vo is important, V and O. So, varicella is having which stain? OK stain or OCA stain. Okay. So, now if somebody will ask you, how are you? You will not say I am okay, you will say I am very okay. Why very okay? Because varicella OCA stain. One of the very known complication, I think if I am not wrong, Justin Bieber had Ramsay-Hunt syndrome. What is this Ramsay-Hunt syndrome? So, remember Ramji, Lord Ram has a beautiful story. Lord Ram had a beautiful story. So, B is important in that. So, what is B? B1 for Bell's palsy, B1 for blisters. So, if a person is having Bell's palsy, what is Bell's palsy? 7th cranial nerve involvement along with blisters on the tongue, tympanic membrane, external auditory canal, external auditory meatus, and this is called as Ramsay-Hunt syndrome. That is called as what? Ramsay-Hunt syndrome. I will show you the pictures. Okay. Okay. First of all, see this picture, the latency. I told you HSV-1, 2 and varicella. Varicella resides in dorsal root ganglia or trigeminal ganglia. HSV-2, 2 means second. So, it resides in the sacral nerve ganglion S, and 1 and T look similar. So, trigeminal nerve ganglia HSV-1. Okay. Then Epstein-Barr virus, I told you this is the 5th one. Okay. Sorry, the HHV-4th. Okay. HHV-4, the mnemonic was glands. So, G gamma virus, L lymphoid cells, so B cells. So, Epstein-Barr, B for B cells, and CMV, that is HHV-5. Okay. This belongs to salivary glands. Okay. So, salivary glands majorly, leukocytes you can also remember. So, coming on to some other pictures. Yeah, this is this we will talk later, CMV, EBV. So, I was trying to show you what? Yeah, the varicella. I had some pictures of varicella. Let me just find out. Yeah, see here varicella. So, can you see? Some are having the pus inside. So, these are pustules. Some are the smaller ones, the macule, the papule. So, it is having the pleomorphic rash. Okay. These are the blisters, right? These are the blisters formed. Okay. Right. I think it is. And now see the dermatomal distribution. It is there in only one dermatome. So, this is what? This is the shingles. This is what? This is the shingles. See here. In one dermatome only, this is shingles. Okay. And what is Ramsay-Hunt syndrome? So, there are two B's. One is the B blister and other is the 7th nerve palsy. Okay. So, 7th nerve which was supplying the the cauda tympani nerve, it was implying the anterior 2/3 of tongue, loss of taste sensation will be gone, there will be lower motor neuron palsy, everything that is going to happen. Okay. Now, in pregnancy I told you maternal Varicella-Zoster infection. So, if it is occurring in first 20 weeks of pregnancy can cause congenital varicella syndrome. And what is congenital varicella? Remember, there will be brain defect, eye defect, limb defect and cicatricial skin lesions. Okay. So, CNS abnormalities, ocular defect, limb hypoplasia and cicatricial skin defects, although the pediatric faculty will take it in detail. See here, the limbs are not formed properly. Limbs are not formed properly. Okay. So, there is limb hypoplasia, eyes defect, CNS abnormalities and everything. Okay. So, this is the varicella. Alright. Yeah. One more thing is the Varicella-Zoster virus can even the reactivation of Varicella-Zoster virus can also called as Herpes Zoster ophthalmicus, can also cause actually. So, it can cause the ocular manifestations also, Herpes Zoster ophthalmicus as well. Okay. So, we discussed about the HHV-3. Coming on to HHV-5, okay, because we are discussing the alpha viruses together. Remember, 5 is the largest herpes. Name itself tells you 𝗖𝗵_virus. So, largest is going to be megalo. This is called as transplant transmitted infections. just like post-renal transplant, you have got this infection. CMV is known to cause retinitis also, it can go in the eyes as well. Then it can cause the pneumonia, it can cause the bloody diarrhea also. Then it is responsible for causing the congenital infection as well, okay, and it is responsible for causing the seronegative infectious mononucleosis. Although the infectious mononucleosis is caused by EBV, and when we will discuss EBV, I will teach you in detail, but as of now you have to remember this, okay. So, if I ask you what was the largest mistake you did in your entire life? Yes, what was the largest mistake you did in your entire life? People will say choosing PCB. So, PCB is the clinical feature of cytomegalovirus. So, what is PCB? P for post-renal transplant infection, P for pneumonia, C for CMV retinitis, congenital infection, B for bloody diarrhea. Okay, got? Yes. How will you diagnose this varicella? So, in order to diagnose varicella, please in order to diagnose CMV, please remember biopsy has owl eye appearance, has got what? Owl eye appearance. So, if I just draw it for you, see here, eyes, one eye, second eye, and just like this. So, it has got owl eye appearance, okay, owl eye appearance, and you can also diagnose it by PP65 antigen detection. PP65, treat 65 as a very big number, so it is there in the megalovirus, cytomegalovirus, okay. And what is the, how will you treat them? With the help of phoscarnet, ganciclovir, valganciclovir. Phoscarnet, ganciclovir and valganciclovir. So, dear doctors, this is not the end of varicella. You have something which is called, this is not the end of cytomegalovirus. Cytomegalovirus is a congenital infection also. So, that is why I urge you to please go to the general microbiology and see the cytomegalovirus from there, what are the manifestations, although the treatment of phoscarnet, ganciclovir and valganciclovir is there. I always teach students like C and G look similar. So, remember for CMV you have got G for ganciclovir and valganciclovir, okay. Yes. Coming on to HHV6 and HHV7, but before we go for HHV6 and 7, let us see some pictures of CMV. So, CMV is known to cause blueberry muffin like rashes. So, if you are a big fan of muffin, I'm sorry, now you will not be these muffin like rashes which will be seen, right, and these are the different manifestations which I was telling you to go and check in the fetal infection video. So, CMV, C for chorioretinitis, yes, I told you retinitis, M for, okay, C for chorioretinitis, M for microcephaly, okay, remember this always, okay. So, yeah, and in the brain it causes the calcification which are paraventricular calcification, paraventricular calcifications, okay, like this. M for microcephaly, microphthalmia also, okay, and because of that C you can remember the cataract and conjunctivitis as well, okay. Pneumonia we have discussed when we discussed the mnemonic of before, just now we have discussed the mnemonic, okay. And yes, other things are given here, you can see, watch them. This is the CMV, esophagitis. So, esophagitis is there with the linear ulcerations. Can you see? The ulcers are more or less linear. The ulcers are more or less linear here, okay. In contrast, if you have HSV-1, HSV-1 has got punched out esophagitis, okay. So, one have punched out and CMV is having the linear ulcers, okay, got it, that is great, that is good, okay. Coming on to HHV 6 and 7, but before we go to the HHV 6 and 7, I just want you to know a table, this table. Remember, some diseases are named just like that, just like see the rubeola causing the measles. So, rubeola is the name of the virus which is responsible for causing measles. Okay. So, measles virus or the rubeola virus is called as first disease. Scarlet fever caused by Streptococcus pyogenes is called as second disease. Rubella or the German measles is caused by the rubella virus called as third disease caused by rubella virus. Then there is no fourth disease, fourth is nothing. Coming on to fifth disease is my name parvovirus B19 causing erythema infectiosum. Please remember E is the fifth letter. So, fifth disease erythema infectiosum. Sixth disease is HHV6. Okay. So, called as roseola infantum. This you have to remember. Okay. Roseola infantum. Sometimes we give this mnemonic as ROSEOLA. These are the 7 letters and 7 letter is 7th disease, I mean the 6th disease caused by 6th and 7th both. So, how to remember? See, you have to remember the S. S is the second. So, the scarlet fever being caused by Streptococcus pyogenes in this is the second disease. So, this is second. Then what is RR? So, below also there is R, rubella virus, above also there is R, that is the rubeola virus. Okay. Then fifth disease, remember E is the fifth letter, I have told you. So, this is the fifth disease erythema infectiosum and always remember me. Okay. And sixth disease is caused by HHV6 only, also called as roseola infantum. Okay. So, the main reason behind telling you this is that most important thing is context of HHV6 and 7 is this only, that it is responsible for causing the sixth disease called as roseola infantum, or it is also called as exanthum subitum. So, exanthum means rash. Okay. But it is a childhood rash, it is self-limiting. First of all, it comes onto the neck and then it goes to the trunk. Okay. So, first of all, it comes to the neck and then it goes to the trunk. Okay. So, how to remember? Remember, it is responsible for exanthum. So, N and T is coming now. First of all, neck and then T for trunk. Okay. HHV6 and HHV7. Coming on to the last second part, this is the Epstein-Barr virus HHV4. Now, Epstein-Barr virus, as I have told you to remember from this B, that it is going to be there on B cells. Now, B cells have got two receptors, one is the CD21 and other is CR2. So, CR2, 2 means bi means B, B means Epstein-Barr virus. Again 21 also has got B. Okay. So, CR2 and CD21 easy to remember, I have given you the trick also. Now, Epstein-Barr virus is responsible for causing B for Burkitt cell lymphoma, B cell lymphoma, and from this lymphoma you can remember other lymphomas like Hodgkin lymphoma and non-Hodgkin lymphoma. Now, because it is a cancer, okay, some cancers I am telling you. Remember, the letter which is close to B is C. So, remember in the Chinese people, because of their food habits, it is responsible for causing the nasopharyngeal carcinoma. Okay. So, in the Chinese people, this is responsible for causing nasopharyngeal carcinoma. Got it? Clear to you? Very good. Now, C and K are phonetically similar. So, Cushing's disease is being caused by this. Now, what is Cushing's disease, or also called as infectious disease or mononucleosis? Remember, it is the sore throat and the lymph node which is getting swelled. So, sore throat and lymphadenopathy, this is called as infectious mononucleosis and Cushing's disease. Okay. And in the mouth only, because the K is coming, okay, the letter close to K is L. So, L for leukoplakia. So, oral hairy leukoplakia. So, there will be white patch, I will show you in the diagram. So, this is a precancerous lesion where you have got a white patch in the mouth. So, let me just show you the Epstein-Barr virus. Yeah, see here. So, Epstein-Barr virus has got this, yeah, this white patch. This white patch is called as hairy, because looking like hairy. Leuco means it is white plakia, hairy leukoplakia. But remember, Candida also causes these kind of white lesions, but Candida infection, they cannot be scraped from the tongue, but here they can be scraped. So, C for Candida, C for cannot be scraped, here scraped, okay, here scraped, okay, clear? Yeah. See here, this is a child coming from Africa, African child with this biopsy, they say as it has starry sky appearance. Yes, definitely pathology ma'am will teach you about it. If the African child with starry sky appearance is coming, the diagnosis is Burkitt's lymphoma, and I am teaching you because the Burkitt's lymphoma is closely related with Epstein-Barr virus. Okay? Yes, this was also my thing to discuss. Okay, I'll come on to this topic once again because the laboratory diagnosis is still left. So, please understand my dear friends, in order to diagnose this Epstein-Barr virus, either you do ELISA PCR or there are 2 or 3 most important tests. One is Paul-Bunel test for Epstein-Barr virus. See, B is coming here. Paul-Bunel test. That means antibodies against Epstein-Barr virus, they are going to agglutinate the sheep RBC. So, for example, this is a man suffering from Epstein-Barr virus. From his blood, you take the sample. Obviously, the sample will have antibodies against Epstein-Barr virus. You take these antibodies, put with the sheep RBC, and these antibodies will agglutinate or kill the sheep RBCs. So, if any antibody is killing the sheep RBCs, that means it is Epstein-Barr virus antibody. If it is present, so you can understand that yes, this person is suffering from Epstein-Barr virus. Similarly, these antibodies are also cross-reacting with horse RBC. The test name now will be monospot test. Okay. So, horse HORSE and monospot, second letter in both of them is O. So, you can remember like that. Whereas, in peripheral smear, you will have some cells called as downy cell, and downy cells appear as ballerinas cut appearance. Again, the B is coming. So, downy and ballerina. So, Epstein-Barr virus, B is coming, and B equals to bi equals to di. So, B for ballerina and D for downy cell. Okay. So, downy cell have which appearance? Ballerina cut appearance. I will try to show you the picture now. Yeah. So, downy cell, see here the downy cells and having the ballerina cut appearance. So, ballerina is actually a dress of I am not sure. I hope the girl students who are watching the session might tell you ballerina. What is ballerina? Please let us know in the comment section what is ballerina. What I know is just like a gown or something like that. Okay. So, basically remember, so what happens is the lymphoid hyperplasia is going to happen. There will be the release of downy 2 type 2 atypical T lymphocytes. Okay. So, T lymphocytes are actually these are T lymphocytes, but now the shape is the downy 2 like that. Okay. The ballerina cut shape appearance. Okay. Like that. Yes. So, this marks the end of the Epstein-Barr virus. Coming on to the yes. So, Epstein-Barr virus we are done. Okay. So, CMV I have shown you the pictures. I have shown you the pictures of Epstein-Barr. Shown you the okay. Kaposi's sarcoma is still left. We will discuss. Okay. Varicella and shingles I have told you. Okay. Coming on to the last part of this video, Kaposi's sarcoma. Kaposi's sarcoma is a human herpes virus 8, okay, or you call it as Kaposi's sarcoma associated herpes virus. Remember, Kaposi's sarcoma, S for sarcoma, S for sexually transmitted. So, Kaposi's sarcoma is a sexually transmitted virus, okay, which causes a sarcoma. Sarcoma means it is a malignancy. Sarcoma means it is a cancer. Okay. So, what happens? How it is causing cancer? Because Kaposi's sarcoma stimulates the vascular endothelial growth factor, okay, and because the growth factors are stimulated, it leads to the growth of the cell, and whenever the cells are growing fast, this is called as cancer. Okay. So, it induces VEGF that causes malignancy of the vascular endothelial cells. Vascular endothelial cells are going to have the cancer. Okay, clear? So, what is the genetics behind it? So, what happens? HHV has got an antigen. So, I will write it as like this. HHV antigen, my dear children, it is responsible for inactivating the retinoblastoma tumor suppressor gene. So, what is the thing? Please understand. So, there is a tumor suppressor gene called as RB tumor suppressor gene, which was suppressing the tumor. Okay. Now, HHV kills this RB tumor suppressor gene. So, now the tumor is not suppressed, that leads to uncontrolled cell proliferation. Okay, uncontrolled cell proliferation. So, HHV-8 inactivates the the retinoblastoma tumor suppressor gene. Now, there is uncontrolled cell proliferation which is going to happen. Okay. There are 4 forms. If you can remember, it's okay. Even if you don't remember, fine. One is classical, one is African, one is organ transplant associated, one is AIDS related. Please remember, AIDS related is very important because 𝗵𝗵𝗃 sarcoma is a AIDS defining event. Okay, it is a AIDS defining event. Okay. Now, coming on to the important part, the clinical feature. It causes the cutaneous disease, that is why we are reading it here, in variety of colors like pink, purple, red, brown, and it often involves the lower extremity, the face and the oral mucosa. Face, or you can say the nose. Okay. So, if I just show you, see here, it is involving the nose, it is involving what? It is involving the nose, it is involving here. Okay. And then these purple, okay, pink, purple, red, brown, yes, involving the oral mucosa. Okay. So, this is how it shows the clinical features. This is the clinical this is the clinical features which I have told you. Here we discussed about the pathogenesis. Okay. And the very important thing which you should understand, that the bacillary angiomyomatosis is a close differential diagnosis to 𝗵𝗵𝗃 sarcoma. Okay. So, one differential diagnosis, if you can remember, that is okay. For those of you who do not know what is differential diagnosis means, close diagnosis. That means 𝗵𝗵𝗃 sarcoma is very same to the bacillary angiomyomatosis. These all things we have already discussed. So, I think yes, this marks the end of the video. Thank you so much. We have discussed all the herpes infections, and yes, a major chunk of soft tissue infection virology, that is herpes, we are done with. Thank you so much for being with us. I will take goodbye. Thank you.